I'm gonna put one little pinch in the skin. You okay?
Mm-hmm.
Good. It's funny, this doesn't bother you at all, but the needle does. And that's, you know. Okay,
I have no idea what you're doing.
Okay, I shouldn't say anything. Just a little pressure, because these are not numb, as you know. I'm just putting pressure to squeeze them out. Aww.
Give her the balloon.
She doesn't want mommy hurt. She's just got little ones there. Sorry, got your hair stuck there. Little ones here, too. See if I can get them out without even. You need one of these instruments. So how'd you happen onto the videos? Were you watching a kid's channel and all of a sudden here you go?
Probably.
An egg thing? Have you seen that egg thing that's like ridiculous? That
No.
crazy thing? There's something that's making so much money on the internet. All it is this woman in another country who opens all these eggs and just like, they're like little, almost like Cracker Jack, and you just open them up and there's like a gift in it. You don't never know what's in it. She never shows her face. She never talks.
Oh, wow.
It's like so many views. It's like one of the top channels. See, that's pretty good. Let me see your nose here for a moment here, if you don't mind. Push against a little bit of it. Oh, you keep yourself nice and clean.
I try.
You're somebody who likes to watch this stuff. You keep yourself nice and clean. You're not giving us any chance. Let's see over here on your chin. You do have a couple right here. Why do you not get these? Because you can't? Because they're just too underneath there?
Yeah.
I'll pinch here. That's why we nick them with a little blade. That's what I'm doing. Sorry, a little pressure. So when you use the Tazorac, which I'm giving you, it's probably going to allow these to come out a little bit better. It's going to soften them. So if you do this again or you do it to yourself, I bet you it'll be easier.
Yay.
Have your little girl here. How old is she?
1 year and 2 months. Yeah, 2 months.
Starting her on a little acne regimen. She has oily skin and a little distribution down here along the, oh, she can speak. She just said, hi, Dad. Dad, have you been teaching her that?
Nope.
Well, she has like a little cyst under here, and I numbed the top of it. So let me just see whether, so that was just accident. The hi, Dad, maybe. There it is, look, there's something over there.
Maybe she wants to learn on her own.
Numbing right here on this little blackhead, I could see how that would be annoying. Baby, pinch here, okay? Pinch. Okay. I wanted to show how I open these blades up and I use them. So they're really short, and usually they'll be on a blade holder, but what I do is I actually wrap them in the foil packet, and it makes it like its own little blade holder. So it's cost effective there. I'm gonna put a little pinch right here. Shouldn't feel anything other than my kind of touching you. I think this one's gonna be a little bit bigger than it looks on the outside. I'm gonna push against you. And hopefully it will never come back.
Good.
So I bet you only get these on your back because that's the only place you can't reach to get them yourself. Good, that's it. We have a little three-fer here, what we got. But I think we got a little whitehead or milia, then a little tag, and then an oil gland. So it makes it look like it's a bigger kind of bump here, baby pinch. So I'm gonna numb it so I can take off your little tag. And then I'm gonna do 3 different treatments here actually.
Wow.
The first one, yeah, 3 little different treatments on this one spot here. One spot here is like a little white milia. What's in milia? So I'm gonna extract that. Pressure here a little bit. There we go, nice milia. One is gone. And then there's a tag. Remember that one? That's actually really why you came in, I think, for this one.
Mm-hmm.
That one's gone in a blink. And then there's something under here, and you know what? Let me just see if there's a little blackhead there. Maybe there is. see one little kind of bump right here. I'm gonna use the other side of this and see if you get. No, it's as I thought. It's a little oil gland. So we have a little oil gland there, which I'm going to use what's called a little black tip, and see if we can't shrivel that a little bit. She's numb here, so she doesn't feel that per se. So this helps to shrink it down. Good. Done. See, Christy. Oh, there. Oh, wait, we got a good one there.
Okay, we gotta stop now.
Okay, yeah, we do. We do have to stop. You want to open your eyes and take a look at it?
La la.
You like that, huh?
Mm-hmm.
Yeah, that was a good one we just got.
Nice.
We'll show it to y'all. Replay that video if you like.
Look, I usually, on Thursdays, I go out to the ranch in Anaheim.
Oh.
And,
oh, yeah. I think I've heard of that before.
Yeah, there's a little place right here on a mountain in the 10 freeway where an instructor, Anne Marie, does some classes. They do like 4 or 5 lessons, and my friend Elliot, he's this younger kid that does line dancing, and he does some lessons there too, and it's only like $5, and you can have dinner and whatever, but I really kind of do it for the exercise, and it's a lot of work, memorization.
Yeah,
you know,
well, keeps your mind awake and moving, huh?
Yeah.
It's kind of challenging that way then, that's good.
Yeah, it is.
It
It
is
is challenging, that's what it is, to say the least.
So you scratch these out, you said, huh?
I've tried.
Every now and then. Yeah, these are deeper.
Yeah, I've really tried.
There's actually like little hairs in them oftentimes. There we go. We got one out.
Oh, good.
I'm sorry if I'm pushing on you
No,
hard.
it
It's right,
doesn't.
right on your...
It's fine as far as feeling. It doesn't.
Yeah, I'm just pushing down on you. And it's kind of like, there we go. Yeah, that one was cooking in there. They have like little hairs in them.
Oh, wow.
That was actually half of one. It came out in 2 pieces.
Wow.
See, they're deep under there. You can't scratch them out. They're just too deep under there.
Yeah, and well, you know, and then when I do try to scratch them out, then they look terrible.
Yeah.
You know, so.
I'm trying to just make a nice little simple slit here so that we can squeeze them out. But they definitely have put their roots down. They don't want to come out without a little fight.
And are they cysts or what is that?
Yeah, I think these are a specific kind of cyst called a steatocystoma or eruptive vellus hair cysts. They're like little cysts that, if you look at them under the microscope, they have little hairs in them, like the hairs that we get on our face, like the side of our face, like the little fuzzy hairs.
Uh-huh. Oh,
So I think that's what we're actually seeing fragment out of them. So just trying to get them out of a small spot as possible. And that just makes me have to use a little elbow grease here. You've had these for many, many years, though.
I know
What'd you
I've
say?
had for, some time. I'm trying to think of, I mean, at least 10 that I can think of.
I think most of the people that I see, they get them, like, they start seeing them during adolescence. Like, it's like puberty, because they're like, they're kind of have like a oil, like a sebaceous gland or oil gland within them. So I think they tend to get like hyperactive, or they notice them at that time.
Well, I don't know if I've had them and then just didn't notice them until like maybe 10 years ago. And then, you know, then I started scratching at them, and then I tried to, you know, buy different stuff for acne and whatever, because I thought maybe that was, but nothing.
I know. It's like you can see it. You'll see when you watch the video that, yeah, you can see there's no way you could get those out with little acne bump. There's a little one right here.
I tried to.
They have a blue color to them oftentimes. I'm not hurting you, right? You okay
No,
there? Okay,
no.
good. I have to kind of pull a little bit and just try to get it loosened up under there.
No, I'm a little tough. I've had a lot of procedures, and I've still got upcoming ones to go.
Oh,
so.
no.
Yeah, I have, you know, it's funny because they're like cysts, but I actually have a polycystic kidney disease.
Uh-huh.
And I'm on the transplant list.
Oh, you are?
Yeah, I'm on.
How long do you have to wait on it?
The
Or like,
list is 8 to 10 years.
oh my goodness.
For
I've heard that if you go to different states, there's different lengths of time,
Yes,
right?
as a matter of
Some
fact,
people do that.
I may end up, if I don't get something soon, within the next, probably by 6 months, I'm going to probably end up maybe trying to go to Oregon because I have Kaiser and they pay for everything.
Oh, wow.
For the donor and myself.
Really?
But the problem is I'm an O, my blood type, and only an O can take an O. So my brother passed away and he was an O, and so I have a daughter and she's an A. But the thing is with the donors, like if you're an A, you can take an A or an O. If you're a B, you can take a B or an O. So anybody who's A and B and O, if they have an O donor, they're taken. The O is harder to find a donor. So I'm working on, there's an exchange program, and I have one person that's an AB. Actually, it's my ex.
Wow, an exchange program. Wow,
Yeah,
it's your ex too.
Yeah,
the drama
ex.
continues.
Yeah, he's, what it is if somebody needs an AB, then he can donate their AB if they have an O for me. And
Gosh.
it's a huge program through UCLA. So,
you know, I used to work at a tissue typing lab in UCLA. I wonder if it's the same place, because we used to deal with that.
Wilshire.
Yeah, it was in Westwood.
Yeah, that's where I go. So, my nephrologist is out of Baldwin Park, Kaiser, but then the surgery is UCLA.
Got it.
And there's UCLA, Loma Linda, Scripps in San Diego, but I'm closest to UCLA, and I heard, they have the best reputations.
Yeah.
I'm hoping that, I got the one person because I'm like at 11%, so I'm